Sexually transmitted diseases have been a scourge on mankind for eons. From the obnoxious gonorrhea, to the potentially deadly syphilis, to the definitely deadly HIV, all of these sexually transmitted diseases have persisted in human populations, and as long as people continue to have unprotected sex, these diseases will spread. Some of these STDs have drugs that can treat them, but other STDs don't. Some STDs can also be prevented with a vaccine, but again, there are some STDs where a vaccine simply hasn't been developed. Chlamydia is one such STD. Chlamydia is one of, if not the most common and widespread STD, and if left untreated, it can progress to cause inflammation and arthritis, and it can even damage the reproductive organs and cause infertility. It can even make the person more susceptible to other STDs. Chlamydia can be treated with various antibiotics like azithromycin or ofloxacin, but there isn't a vaccine for it, so we have treatments that can respond to it, but we don't have a preventative measure. This is frustrating, as the drugs take some time to be fully effective, which means the patient can compromise their treatment by not taking the full regime, and so still retain the disease and pass it on to another hapless sexual partner. This is also compounded by the fact that chlamydia often doesn't have any symptoms at all. Up to 3 in 4 people infected with chlamydia don't show any symptoms, so they have no reason to go get checked and treated. To prevent infections and to slow or stop the spread of the disease, a vaccine is a much better treatment. So it's pretty awesome that a new chlamydia vaccine is in early clinical testing, and its first trial was a success. This first trial included 35 healthy women, and it was performed by researchers at the Imperial College London and the Statens Serum Institute in Copenhagen. The women who were the patients in the sample did not have chlamydia, they were otherwise healthy. Instead, they were given several intramuscular injections over several months to see if their immune system would react to the vaccine and create antibodies. One group was given a vaccine loaded with liposomes. Another group were given a vaccine loaded with aluminum hydroxide, and a third group was given a placebo. These different treatments were to see if different delivery mechanisms had a different effect. And while both had an effect, the liposome vaccine seemed to outperform the aluminum hydroxide and stimulated the production of more antibodies. The placebo group experienced no immune response, but 100% of the patients in both test groups did have an immune response. And as I just said, the ones with the liposome vaccine had a stronger response. Professor Robin Chaddock, head of mucosal infection and immunity within the Department of Infectious Disease at Imperial College, was a leader of the clinical research in the UK. He said, quote, "The major issue with chlamydia is the long-term consequences. It is very treatable if identified, but as many people don't have symptoms, it can be missed. And the biggest problem is that it can go on to cause infertility in women. One of the problems we see with current efforts to treat chlamydia is that despite a very big screening, testing, and treating program, people get repeatedly reinfected. If you could introduce a protective vaccine, you could break that cycle." Unquote. The day that Professor Chaddock is talking about is near at hand. The success of this initial test means that the refined vaccine, probably the liposome-based vaccine, will go on for further trials, and if it keeps showing success, this one day might be a market product. This might be something that is included in a round of childhood vaccines to make the child strongly resistant to chlamydia for their entire life. Perhaps they'll need to re-up on their chlamydia vaccines every 10 years or so, like a tetanus shot, but this will all be worked out in future studies. But for now, where things stand now, it's looking pretty good. It's looking like one day in the near future, we might have a vaccine for chlamydia.